Let's begin with our topic, infectious medicines topic of rubeola and rubella. First, the rubeola. Rubeola is also known as measles. That's the rash of the rubeola or measles, and that's the magnification how the rash appears of the measles or rubeola. The epidemiology of rubeola. Here in this chart, you can see the number of measles cases reported by year. So annual statistics of the measles infection, and this is from year 2010 to 2018. So it's of 8-year statistics of measles. In 2010, it's 63. 2011, you can see it's about 220 cases. 12, it's 55. 2013, 187, and its maximum in 2014, it's about 667 cases, and again it's on a rise in 2018, about 349 cases. So this is just a statistic showing that in 2010 there are less number. 2012 it's 11 is increased, and 12 it's again fall. So there is a constant fall and rise in the number of cases of the patients who are suffered from the measles infection. Next, the etiology. What's the causative agent of rubeola or the measles infection? The measles virus, that's the picture showing the measles virus. So that's the causative agent. So it's a viral infection caused by the measles virus, and it's known as rubeola or measles. The pathogenesis, how this infection develop and what's the process, how it access the person and how it progress and develop. The pathogenesis is the host cell nucleus is attacked by the measles virus. These are the viruses, and then there is a fusion, and it causes RNP, leads to RNP, and then there is messenger RNA synthesis, and this messenger RNA it is the viral messenger RNA, and this viral messenger RNA attacks the host cell nucleus, and it attacks the Golgi complex in the cell as a result of translocation and modification of viral messenger RNA. So the pathogenesis is the viral, the measles virus, it undergo the fusion, form RNP, and then it cause, under the influence of messenger RNA synthetase, there is synthesis of messenger RNA that forms viral messenger RNA. This viral messenger RNA undergoes translocation and modification, and it goes to the Golgi complex, and then again it causes infection in the host. This is the virus titer, and then days after infection. What are the different organs affected by the measles virus, and how many days the infection? You can see from 5 to 20 days here, days after infection. So once the infection by the measles virus occur in the very beginning, usually in the first 5 days, there is involvement of respiratory epithelium leading to respiratory distress or infection, local lymph node involvement, then there is blood involvement, spleen, lymphatic tissue, lungs, thymus, liver, skin. And you can see the virus titer is increasing as the days progress, and then it is affecting different organs of the body, respiratory epithelium, then lymph nodes, blood, spleen, lungs, thymus, liver, skin. All these different organs are affected as a result of infection, and usually from the beginning to about the 10 days, there is the maximum titer of the virus, and then slowly it comes back to the low level. So from day 1 to 10, usually the maximum period of maximum level of the viral titer is present. Then again, the severity of clinical symptoms. Involvement slowly occur first in the first 10 days, and then in the second half, after the 10 days, the symptoms appear more. So in the first half, the organs are affected, the level of virus increases, and then in the second half, mostly the clinical symptoms start showing in the second half. So in this we have fever, cough, conjunctivitis, then the rash appears at the peak, which is at about 10 to 15 days, and then we have Koplik spots also appear. So important, the measles infection is caused by the measles virus. It and undergo the fusion process. There is there is messenger RNA synthesis leading to formation of viral messenger RNA that affects the Golgi complex and then attacks or cause problem in the host cell, and it is the first, we can say the time is between 1 to 20 days. In the first half, up to 10 days, usually the organs are affected, the virus level is increased slowly, and then in the second half, mostly the symptoms or clinical presentation occurs. Then the immune response in the infection or the immune response in rubeola, that's the immune response, and then the days after infection. So what's the immune response and after how many? So usually it starts, the immune response is around 8th day, close to the 10th day. So here, so these are the red. Here, this is the CD4 T cell level, so immune response of CD4, this red, so it starts in the 8th day, reaches to the maximum is at about 15 days, and then it is stabilized throughout the period. Then green, we have immune suppression. This is the immune suppression. CD8 T cells, this is the maximum peak is at about the 15th, 16th day. Then IgM level, this purple, this is the IgM level. And then we have IgG constantly increasing after about the 17th day. So these are all the immune responses of the individual after the measles infection. CD4, CD8, IgM, and IgG. Then the clinical manifestations of measles or rubeola infection. The clinical manifestations, there is fever, malaise, cough, coryza, conjunctivitis. Coplic spots appear. Here you can see the coplic spots. Headache, abdominal pain, vomiting, diarrhea, and then myalgia. So these are some clinical manifestations. There is rash, there is fever, malaise, myalgia, cough, coryza, conjunctivitis, abdominal pain, headache, vomiting, diarrhea. All these features are present. Then the differential diagnosis of measles. What are some conditions that needs to be differentiated from the measles? This is rubella rash. That's the Kawasaki disease. You can see the difference between this rubella rash and this is the Kawasaki disease. Infectious mononucleosis, roseola, scarlet fever, Rocky Mountain spotted fever, enterovirus or adenovirus infection, then the drug sensitivity. So all these are different infections that cause the rash, and you can see the difference between different rashes, how the measles rash appear and how the rubella, then we have Kawasaki disease, very characteristic. There is erythema, and you can see there is spots in the rose. Infectious mononucleosis caused by Epstein-Barr virus, that is the characteristic rash in the palm. Then we have roseola rash, scarlet fever with the cheeks involved, red cheeks, this scarlet fever. Then Rocky Mountain spotted fever, very, you can see big spots and rash. And then enterovirus and adenovirus infection, and this is very characteristic of urticaria caused by the drug reaction. Then some other conditions, chickenpox. Here, that's the rash of the chickenpox. Then the measles rash, you can see the difference. This is more hair on the top of the chest area. This is from the forehead, and then that's the rash, that's the of the chickenpox and the measles. And then we have conjunctivitis, involvement of the eye in the measles also. Headache is present in chickenpox. There is fatigue or tiredness. Red spot first appear on the chest, face, and back. There is decreased appetite. Spots turn into itchy blisters. In measles, the rash first appear on the forehead, runny nose. There is red inflamed eyes, hacking cough and sore throat, coplic spot inside the mouth. So these are very important differentiating features between chickenpox, measles, closely related. The rash is, but one is more started at the chest, face and back, the other one on the forehead. Then in the measles, we have the inflammation of the eyes also, and there is hacking, cough, sore throat, coplic spot inside the mouth. You can see these spots when the mouth is observed. The diagnosis of the rubeola and measles, we have a clinical diagnosis, a generalized maculopapular rash of at least 3 days duration, fever of at least 38.3 degrees Celsius, cough, coryza, or conjunctivitis. Serology, the blood test done on the serum, we do these virus specific IgM levels and IgG antibody. Neutralization test, and then we have enzyme immunoassay test. So clinical diagnosis, and then we have the other methods of diagnosis, which is serology, neutralization test, and enzyme immunoassay test. Virus isolation again is very specific test. Once the virus is isolated, measles virus is isolated, that's the definitive diagnosis. And then PCR or polymerase chain reaction. Then the complications associated with the measles, we have intracellular multiplication within lymphoid tissue. So measles infection, there is intracellular multiplication within the lymphoid tissue, immune activation and antibody generation occurs. Then there is formation of self-antibodies due to pathogen molecular mimicry, autoimmune attack on the myelin sheath occurs. Then there is ADEM and fever, headache, neck stiffness, BBD, mental status changes, sensory and motor changes. So there is multiplication in the lymphatic tissue, generation of antibodies, generation of self-antibodies, and there is fever, headache, mental status changes. Then the other scenario is viremia and systemic dissemination occur via lymphatics to the cornea, causing ulceration and keratitis. Ocular pain, vision loss. It also affects cardiac system involving myocardium, causing myocarditis. It involves pericardium, causing pericarditis. And it leads to chest pain. Then lower respiratory tract involvement cause inflammatory response, air spaces filled with white blood cells and inflammatory fluid. So all these changes can occur as a result of measles virus or measles infection. It involves the cornea, affects the vision, it affects the heart, cardiovascular system, or it affects the respiratory system. And it can cause pneumonia. So measles is, as a result of complication, measles can become a very serious infection. And pneumonia can cause cough, shortness of breath, fatigue, fever, and hypoxemia. So two pathways we can say occur. One, there is intracellular multiplication in the lymphatic tissue causing activation of immune system, causing activation of antibody formation, and there is self-antibodies. Those attack the autoimmune attack on the person's immune system. This can cause complications like motor, sensory changes, neck stiffness. Or if there is spread from the lymphatic, via the lymphatic to different systems, including the cornea, cardiovascular, and the respiratory, cause chest pain, pericarditis, myocarditis, pneumonia. So all these complications can occur as a result of measles. Some other complications: when gastrointestinal tract is involved, it can cause, when it affects oral mucosa, it causes stomatitis. There is focal pain at the oral cancer. If it involves the mucosa of intestine, it causes inflammation and nutrient absorption decrease. So there is inflammation, and this causes decrease in the absorption of nutrition. And there is abdominal pain and diarrhea. If it affects the liver, then there is hepatitis that cause pain in the right upper quadrant, and there is nausea, vomiting. So if you can see, measles can be a multi-system disease. Once the complications occur, it is affecting heart, it is affecting the lungs, respiratory system, GI tract, and it affects the oral cavity, liver, and intestine. So it's pretty much a multi-system disorder. And it affects the immune system, and T cells are affected, dendritic cells are affected, cause decreased antigen presentation, decreased T cell activation, and immunosuppression. And once the immune system is affected, immunosuppression occurs that further aggravate the condition, and further complications can occur. So measles can be a serious life-threatening condition because of its serious complications that can occur. And there is also decrease in the T cell. And again, once the immune system is suppressed, then different opportunistic infections can occur. Infections which are not serious in normal healthy individual with normal healthy immune system, those are attacking the person, and it becomes more aggressive. Prevention, how we can prevent the measles. There is a vaccine known as MMR. It's the immunization consisting of measles, mumps, and rubella. So its first dose of immunization or vaccination is given at 12 to 15 months of age, and the second is at 4 to 6 years, and it's very important, and it's effective. Next condition which we will discuss after the rubeola or the measles is the rubella, and rubella is also known as German measles. The etiology of rubella or the German measles is the virus known as the rubella virus. The pathogenesis, how it occurs, they infect rubella transmission. So infect cells in upper respiratory tract. So rubella, it affects the upper respiratory tract, so it can be transferred as a result of aerosol or droplet inhalation, and it affects the upper respiratory tract. So after the virus enters the upper respiratory tract, the virus multiply, extend in the regional lymph nodes. Virus replicates in the nasopharynx, and infection established in skin and other tissues. So again, it affects the upper respiratory tract. It can spread from one person to another, but it can be inhaled and as a result of inhalation of droplets, and then the virus multiply in the nasopharynx. It goes into the regional lymph nodes, and then it is established in the skin and other tissues. And then it forms the Forchheimer spores. Now, the pathology of rubella or the German measles, that's the histological slide of the patient with the rubella or the German measles. Clinical features of rubella infection, we have acquired rubella and the congenital rubella. Remember, make sure you should know that congenital rubella, we will discuss later on also, that it's a serious condition. It can, the pregnant women can transfer the infection to the fetus, and it can cause complication in the baby. So that's the congenital rubella. So it can be acquired or congenital. So acquired rubella present with maculopapular rash, and make sure you should know that it's a generalized maculopapular rash in the rubella infection. Then patients usually have low-grade fever. Fever is commonly present in all different infections. So in this case also low-grade fever is present. There is malaise, patient is weak, there is no energy, tired. So that's an important presentation of acquired rubella also. So generalized maculopapular rash, low-grade fever, malaise, and then we have upper respiratory symptoms, because we already mentioned that it enters through the upper respiratory tract through the inhalation of the droplets, and it multiply in the nasopharynx. So it is affecting the epithelium of the respiratory tract, upper respiratory tract. So symptoms associated with upper respiratory tracts, cough, sneezing, runny nose, all these are present in this acquired rubella also. Then lymphadenopathy, because of presence of the virus, it attacks to the regional lymph node, it spreads to the regional lymph nodes, and it can cause lymphadenopathy, and enlargement of the regional lymph nodes, especially in the neck, is very, very common in this acquired rubella. Then arthralgia and arthritis, which is the pain in the joints and inflammation of the joint that causes pain in the joints, swelling in the joints. All these are very characteristics of arthritis and arthralgia. So again, acquired rubella causing maculopapular rash, arthritis, arthralgia, malaise, and it causes generalized, not generalized, regional lymphadenopathy, and upper respiratory symptoms are present. Next, the congenital rubella syndrome, as the name shows, is the congenital rubella infection, and it spreads from the mother to the baby. And if during the pregnancy mother acquired rubella, because of the severity of congenital rubella syndrome, it's usually recommended that the termination of pregnancy should be performed because of the seriousness of the congenital rubella syndrome that is affecting the newborn baby. So the characteristics of congenital rubella rubella syndrome, it affects the eyes of the baby and it can cause a cataract formation is there. That is the clouding of the cornea, and it's the corneal opacity. Cataract is corneal opacity. Normally, it's the condition that affects the old age mainly, when the cornea becomes opaque and you can see white color in the eyes. But it's in congenital rubella syndrome, cataract is present in the babies. Cataract, then there is involvement of the retina, which is the innermost layer of the eyes, and where the image is formed, it causes involvement of the retina also. There is microphthalmus, small eye. Micro is small, so eyes are small. Microphthalmus. Then there is glaucoma. Glaucoma is a condition in which there is increased intraocular pressure or increased pressure of the eyes. So all these are characteristics of the involvement of eye as a result of congenital rubella syndrome. Cataract, retinopathy, microphthalmus, and glaucoma, which is increased intraocular pressure. Then cloudy cornea is also present. Next, babies with congenital rubella syndrome, they are low birth weight at term. Their weight is not normal. They are low birth weight babies. They have failure to thrive. Mortality rate is high. Complications are high. They are weak, wasted, low birth weight, and they have failure to thrive. Retarded growth. Growth is retarded because of all these different complications that can occur. And then babies who are low for birth weight, they are itself, it's a condition that can cause retarded growth and failure to thrive. Congenital heart disease is associated with congenital rubella syndrome also. Thrombocytopenic purpura. Thrombocytopenia is a condition in which there is decrease in the platelet count. Platelets are the cells present in the blood that are responsible for the clotting of the blood. So in this, there is also thrombocytopenic purpura present. Then there is hepatosplenomegaly. Both the liver and the spleen are enlarged. The spleen and liver are present, are enlarged, and you can feel the liver and spleen in the abdomen when they are enlarged. Then there is osteopathy. Osteo is the bone. There is pathology or abnormality of the bone that is also present in congenital rubella syndrome. Then there are some findings which are associated with the brain and the nervous system. One of them is microcephaly, small head. Micro is small, cephal is for head. So there is small head, small brain. So microcephaly is present. Cerebral palsy is also present. And there is bulging of anterior fontanelle. Fontanelles are the spaces in the brain which are not united in the skull bone. So once the brain start growing after the birth, these fontanelles slowly close. So there are bulging or enlarged anterior fontanelles which are present in the head or the skull. So all these are different characteristics associated with congenital rubella syndrome. Speech disorder is also present. So these children usually which have congenital rubella syndrome, they have lot of complications, high mortality rate, failure to thrive, growth retardation is present, heart problems are present, and then they have microcephaly, small head, microthalamus, small eyes, enlargement of the liver and spleen. Deafness ear are involved also and it causes deafness. Adenopathy, enlargement of the glands. Then the diagnosis of acquired rubella, how we diagnose the acquired rubella infection by the serologic method, which are the tests done on the serum, IgM testing. These are all different antibodies, IgM testing, IgG testing, IgG avidity testing. So these are the tests done on the serum. Then virological methods for the diagnosis, isolation of the virus, as I mentioned for the measles, that once the virus is isolated, that's a definitive diagnosis that this infection is present. And then we have polymerase chain reaction test is also performed. Then the diagnosis of congenital rubella syndrome, again serologic assays, test done on the serum. Virus detection of the virus, causative virus, again is helpful in the diagnosis. Rubella serum IgG titer is helpful in the diagnosis. And then polymerase chain reaction. So in both acquired and congenital tests are pretty much the same. We have IgG titers, serological testing, virus detection or virus isolation, and polymerase chain reaction test. Next, diagnosis in pregnant women, how we diagnose the rubella in the pregnancy. The rubella IgG antibodies, they are positive. So very, very important diagnostic step in the pregnancy is presence of rubella IgG antibodies. If it's positive, it means that that pregnant women have rubella infection, and there is likelihood that she can spread the infection to the baby. And we know that so many complications associated with congenital rubella syndrome. So diagnosis is very, very important, that it needs to be diagnosed early and managed and treated early. So we should know, we should try to avoid that serious outcome of the pregnancy that is associated with the congenital rubella, and that is affecting the eyes, heart, nervous system, bones. So pretty much all the organs of the newborn babies are affected by the congenital rubella syndrome. So if rubella IgG antibodies present during pregnancy, measles, mumps, rubella, MMR is the immunization, vaccination used for measles, mumps, and rubella. It's covering 3 infections, measles, mumps, and rubella. First dose is given routinely at 12 to 15 months of age, and the second dose is in 4 to 6 years is given, and it is quite effective in prevention of measles, mumps, and rubella. And then we have also the intramuscular 20 ml of immunoglobulin are used within 72 hours of rubella infection, and this immunoglobulin is also very effective in boosting the immune response, try to fighting the infection, and it's very important that we should give this immunoglobulin therapy to prevent the complications associated with the congenital rubella syndrome, because it is associated with very high mortality and morbidity rate, and besides the baby that is born, it's very hard to survive, and it is babies has so many different complications that if the diagnosis of congenital rubella or rubella infection is diagnosed in the pregnant women, it's better to, depending on the stage of pregnancy, sometimes therapeutic abortions are recommended so we can avoid that congenital rubella syndrome or congenital infection in the newborn babies, because it is affecting all the organs of the baby, including the heart, nervous system, eyes, ears, bones, lymph nodes, abdominal organs, so everything is affected. So measles and rubeola and rubella caused by the virus infection, then the multiplication of the virus inside the body, and it can cause different effects and different complications, both pretty much affecting the multi-systems or multi-organs of the body. So that concludes our topic of rubeola and rubella, and we talked in detail about all the aspects of the two infections. Thanks for watching sqadia.com.